What's going on, guys? It's Jimmy here. If you've been watching my show, you know what's going on here with our country being hacked from both Russia and China. We've had our government being hacked. We've had our airports being hacked. We've had our military being hacked. We've had our school systems being hacked. And it's not getting any better, and it's happening frequently. And now we have our hospitals being hacked. And well, another one just happened here, and potentially hundreds of hospital systems being hacked. And your medical records could be at stake here. And we don't even know how deep this goes yet. And this is a big one, affecting lots of them countrywide here. Take a look at what just happened here, and then we'll discuss.
It's the largest cyber attack on hospitals this year. Prospect Medical Holdings, which owns more than 170 medical facilities in California, Pennsylvania, Rhode Island, and Connecticut, says it took its national computer systems offline Thursday after discovering the ransomware attack. In a statement saying, "We are focused on addressing the pressing needs of our patients as we work diligently to return to normal operations as quickly as possible." The attack is forcing doctors and nurses to use pen and paper instead of computers. Some outpatient facilities have closed and some elective surgeries canceled. Student nurse Eduardo Origel says he works at one of the affected hospitals.
It's a whole commotion in there. It's just constantly going back to the charts again. Something we could have done easily mere 2-3 minutes on a computer is taking forever now.
The FBI is now investigating.
Well, I'm concerned about being able to see my doctor and getting the updated lab reports.
The Prospect hack is one of about 275 cyber attacks on U.S. healthcare organizations this year, according to John Rigi with the American Hospital Association. He says the recovery process can often take weeks and disruptions can delay healthcare.
Think about it. As ambulances may be diverted carrying stroke, heart attack, or trauma patients, that certainly increases the risk of a negative outcome.
These increasing attacks have also impacted local government, schools, and businesses as hackers hold systems hostage, demanding payment to make them accessible again. And when hospitals are attacked, lives are threatened.
So, Dana, what can patients do now to protect themselves?
Well, it's still unclear if these attacks have actually impacted patient records and information, but cybersecurity experts say that patients can change their passwords and closely monitor credit bureaus.
Yeah, as you can see here, hospitals and clinics in several states have begun the time-consuming process of recovering from a cyber attack that disrupted their computer systems, forcing some emergency rooms to shut down and ambulances to be diverted. Yikes. Many primary care services at facilities run by Prospect Medical Holdings remain closed on Friday and Saturday, and we don't even know how deep this rabbit hole goes yet, as security experts work to determine the extent of the problem and resolve it. John Riggi, the American Hospital Association Network Advisory for Cybersecurity and Risk, said the recovery process can often take weeks, with hospitals in the meantime reverting to paper systems and humans to do things such as monitor equipment and run records between departments, which takes much longer than what these computer systems do. And with staffing shortages, just they're not equipped to do this type of stuff that computers do now. They just don't have as much staffing that these computer jobs do now. These are threat to life crimes which risk not only the safety of the patients within the hospital, but also the safety of the entire community that depend on the availability of the emergency department to be there. The latest data security incident began on Thursday in facilities operated by Prospect, which is based in California, has hospitals and clinics in Texas, Connecticut, Rhode Island, and Pennsylvania. Upon learning of this, we had to take our systems offline to protect them and launch an investigation with the help of a third-party cybersecurity specialist, they said in a statement on Friday. And the White House has been monitoring the cybersecurity attack and said the Department of Health and Human Services has been in contact with the company to offer federal assistance, and we are ready to provide support as needed to prevent any disruption to patient care as a result of this incident. We have a national prospect team working and evaluating the impact on the attack on all organizations, they said in Eastern Connecticut Health Network. The FBI in Connecticut issued a statement saying it is working with law enforcement partners and to identify the victim entities. The incident had all the hallmarks of an extortive ransomware, but the officials would neither confirm nor deny this. In such attacks, criminals steal sensitive data from targeted networks, activate encryption malware that paralyzes them, and demand ransoms. The FBI advises victims not to pay the ransoms, which in this case could be the hospitals, as there's no guarantee the stolen data won't eventually be sold on the dark web criminal forums. They said that paying the ransoms also encourages the criminals and finances future attacks. Yikes. As a result of the attacks, elective surgeries, outpatient appointments, blood drives, and other services were suspended. And while emergency departments reopened in some cases late Thursday, many primary care services were closed on Friday, according to Eastern Connecticut Health Network, which run many of Connecticut's facilities. And honestly, this goes on for several states. In Pennsylvania, the attack affected services including the Crozer Chester Medical Center in Upland, Taylor Hospital in Ridley Park, Delaware County Memorial Hospital. In California, it affected hospitals in Los Angeles, Orange County, 130 bed acute care hospital in Los Angeles. This is a nightmare, guys. And just to give you just even a small idea of this, globally, the healthcare network was the hardest hit by cyber attacks. In the year ending March, according to IBM's annual report on data breaches, for the 13th straight year, it reported the most expensive breaches, averaging $11 million each per breach. Wow. Next was the financial sector at 5.9 millions. Healthcare providers are a common target for criminal extortionists because they have so much sensitive patient data, including healthcare histories, payment information, and even critical research data. Hospitals have been trying to put in place better safeguards and more backup systems to prevent such attacks and respond to them when they occur, but he said it is almost impossible to make them completely safe, especially because the systems they need to rely on the internet and network connected technologies to share patient information among clinicians involved in a patient's care. What a nightmare. What a nightmare. And I don't know if they have any suspects in this or not. We have seen a lot of these hacks coming from Russia, China, and some from North Korea. Um, Now, that's not to say that some of these hacks don't come from the United States, but that is where we have seen a lot of these hackers come: Russia, China, and North Korea. And I think a lot of this is because we can't really persecute them from those countries. They're really kind of out of our reach. Yeah, we can't exactly go into Russia and arrest them. You know, that's part of the problem there. So let me know your thoughts on this. But yeah, so again, if you got medical information there, change your password maybe on a regular basis. Try to keep your stuff safe and secure. If you're maybe if you are with this company, maybe call them. Maybe you'll get a letter in the mail, but it might it might not hurt to check in with them and see what protocol might be the best for you to go do going forward. Let me know down below in the comment section if you're affected by this or if you've had something like this happen below in the past. If you don't want to, no big deal. But this is something to be concerned about here, as here today in today's internet age. It's definitely something to be concerned about. So if you haven't yet, click subscribe down below and the bell icon so you don't miss out on any new videos. I'll keep you up to date here. It's completely free to do so. New videos come out here every day at 10 a.m., 3 p.m., and 8 p.m. Eastern Standard Time. Also, thanks for hitting the like button for us and share these videos so other people can see this. Click here to see what Wells Fargo Bank and other banks are doing right now, which is really a scandal. Or you can click here to see what Walmart, Target, and Kroger are doing right now, which has a lot of people concerned with. Click on one of those videos next. Thanks for watching, guys, and I'll see you in the next video.